Hi everyone. Today I'm going to be talking about PCOS or Polycystic Ovary Syndrome. Now, PCOS affects millions of people worldwide. It's one of the most common hormonal conditions, yet it's also one of the most misunderstood. In this video, I'll cover what PCOS really is, how it affects the body, what causes it, how it's diagnosed, and the different ways it can be managed. By the end, you'll have a clear science-based understanding of PCOS. Now, PCOS, as I said, stands for Polycystic Ovary Syndrome, and it is a hormonal and metabolic disorder when basically the ovaries produce too much of certain hormones, especially androgens, sometimes called male hormones. Though everyone has them, with people or women that have PCOS, they will have an increased amount of these androgens. And essentially, these hormones or androgens will disrupt the normal menstrual cycle. So instead of releasing an egg regularly each month, ovulation can be irregular or sometimes absent. And because of these changes, small fluid-filled sacs, as you can see on this ovary here, sometimes referred to as cysts, may appear on the ovaries. Though not everyone with PCOS, it's important to note, has cysts on their ovaries. However, and that's sort of why the name can be misleading, because not everyone will have this symptom or manifestation of the disease. Now, looking at sort of PCOS globally, PCOS affects an estimated 8 to 13% of women worldwide and of reproductive age, but nearly 70% of women will go undiagnosed. Now, you might ask why this is. And generally, it's because the symptoms vary so widely, and many are mistaken for normal changes during puberty, stress, or other conditions. Now, as I said in the last slide, because symptoms can range from mild to severe, PCOS is a condition that is often misdiagnosed or just described to women as normal effects of just having hormones that are shifting regularly. However, the most common symptoms of PCOS are irregular periods. And so basically this can be described as cycles that are longer than 35 days with very light or heavy bleeding or missed periods. Also, for infertility, which can be caused by irregular ovulation. In fact, PCOS is one of the leading causes of infertility worldwide, as well as excess androgens, which I think I mentioned in the last slides. And this can cause acne, oily skin, hair thinning on the scalp, and unwanted hair growth on the face, chest, or back. Also, metabolic effects will be caused by PCOS. So many people with PCOS struggle with weight gain or find it harder to lose weight due to insulin resistance. As well as skin changes is a common feature or symptom of PCOS. So you may find dark velvety patches often on the neck, armpits, or groin. However, it's important to note that not everyone will have all of these symptoms that I've mentioned. PCOS is a spectrum disorder. So scientists don't actually know the exact cause of PCOS, but several factors are involved. Number one, insulin resistance. So up to 70% of people with PCOS have some form of insulin resistance, When cells don't respond properly to insulin, that's essentially insulin resistance. So the body produces more insulin because the cells are not responding to the amount present, essentially. So high insulin can trigger the ovaries to make more androgens, which will disrupt ovulation. With regards to hormonal imbalance, people with PCOS will have higher LH, or luteinizing hormone, compared to FSH, which is follicle stimulating hormone, and this can prevent proper egg development. As well as, of course, with regards to the hormone imbalances, you will see an increase in androgens like testosterone that is more present with people that have PCOS, and this, of course, will interfere with the menstrual cycle. Another cause of PCOS, or another factor that contributes to its development, of course, it has a very strong genetic component. So PCOS often runs in families. So if your mother or sister has it, your risk is higher. And lastly, environmental factors. So that being sort of environmental and lifestyle factors. So things like diet, stress, and exposure to endocrine disrupting chemicals will also play a big role. And a lot of research is actually ongoing and looking specifically into the space. So with regards to diagnosis, doctors don't use one single test. Instead, they often rely on the Rotterdam criteria, which requires at least 2 out of the 3 to be present. So the 3 sort of criterias are irregular or absent ovulation, which will be shown by missed or irregular periods. Higher androgens will be the second criteria, which can be seen in blood tests, for example, having high testosterone, or it can be seen in physical symptoms like acne or excessive hair growth on the chin or in places that hair wouldn't otherwise be growing. And then lastly, polycystic ovaries, which will be visible on an ultrasound. So it's important to rule out other conditions. I want to note, because a lot of conditions can mimic PCOS, like thyroid disease or even high prolactin levels. So when looking at treatment options, there is no universal cure for PCOS, but symptoms can be managed based on individual needs, and there is ongoing research and a lot of sort of positive effects that many people will see when they look into or focus on factors like lifestyle changes. So that being balanced diet, regular exercise, and weight management will improve the insulin sensitivity and hormonal balance that are often sort of side effects of PCOS. And then, of course, another treatment option that can work for some people are medications. So that being hormonal birth control to regulate cycles and reduce androgen symptoms, metformin to improve insulin resistance and to regulate cycles. Within medications also, there are anti-androgens for acne and hair growth, which some people look into. And then lastly, a big effect of PCOS can be fertility issues, especially if people are looking to get pregnant. So there are some assisted reproductive technologies if pregnancy is desired, such as certain medications. However, there's also things like egg freezing and all sorts of things that have come out in the past 10 years. So the approach is tailored with regards to treatment according to the patient's needs, of course, and the priority is always regular cycles, for everybody, whether somebody is trying to get pregnant or not. So why does PCOS matter, especially in the long term? So why can't a woman just sort of let it be? It is not a very dangerous condition. However, PCOS isn't just about periods and fertility. It's actually linked to some serious health risks in the long term, including type 2 diabetes, high blood pressure, high cholesterol, sleep apnea, mental health issues like depression and anxiety, and actually endometrial cancer from unopposed estrogen when periods are infrequent. And so this actually makes early diagnosis and consistent management really important. And so early diagnosis really matters, especially for sort of long-term health. And yeah. So PCOS is much more than a reproductive condition. It's important to note that it's a complex hormonal and sort of underline here metabolic disorder that affects the whole body. And while it can't be cured, it can be managed with the right support. People with PCOS can go on to live healthy and fulfilling lives. And so that is why early diagnosis and treatment is very important. If you found this video helpful, please like, share, and subscribe for more women's health content. And let me know in the comments which topics you'd like me to dive into next.